I'm going to show you today how to use Leukotape in a tab taping fashion, one of the lost arts of tab taping, for medial meniscus injuries. And if you have knee pain today, a lot of times this can decrease it. So talk to your healthcare provider. Here we go with the video. Okay, this is Leukotape. This is the tape that I would prefer for many different types of things. I'll put a link below so you can see. This is a cover roll, okay? Super important aspect of using Leukotape. The main reason is because Leukotape is sticky as hell. And that's good and bad, but I mean, you buy a cover roll and then you're in shape here. But basically what we're gonna do is we're gonna do a tab taping method. And so this one actually too is super sticky too. Make sure you clean the person off, alcohol swabs, and make sure that they are aware that see if they have any skin conditions as well. They might irritate it. So we're going to find the joint line here. Let's make sure we get the right spot here. Good. Okay.
It's right?
Yeah, right there. Yeah, if it hurts, it's right. Okay, so we're going to find the joint line right here. And since she's dealing with a medial meniscus issue, it's going to be, we're going to tape it just like that. What we're going to do with this tape is we're going to form a tab. Think of it like a skin tab, because it's pretty much kind of just like that. But you see how sticky it is already. I can't even barely get it off my hands. So we're going to fold it in the middle, just like that. And then these other ends are ones that we're going to have right onto that cover roll. So we're going to find the area again where it hurts. We're going to make sure we don't hit the skin. I probably could have done a smaller tab actually. Okay, make sure we have a secure anchor right there on the cover roll. Now basically what we can do here is we can pull this way or this way, and we can actually go through movements like squatting and all that kind of stuff and see what movement makes her feel better. And basically what's happening here is we're kind of pulling like the fascial attachments to the skin. We're not actually moving the meniscus, but we're affecting the fascia and the overlying tissue, which actually attaches in there as well. So you find the position of comfort. Then we basically just lock it down. So let's just say, just for simplicity, let's say this makes her feel better. So now we're going to take it. Let's see if I can get the camera to see. So we're going to lay it on so it gets that tab right there, and then we're going to pull it all the way across. And just for the sake of video, I won't even bother attempting to improve that. But basically you can lay a couple layers down here and keep increasing the tightness of it. Just like that. Okay? And you see we did increase the tightness of it because you can see some of the wrinkles here under the cup.